who have been following health care for a long time, both in the 80s and the 90s, and also this law, knew that that promise was not going to be able to be kept as the president made it. And in fact, in 2010, you might remember President Obama had that big health care summit across the street from the White House at Blair House. All the Republicans came, Democrats came. And here's an interesting exchange from 2010.
Between 8 million and 9 million people may very well lose the coverage that they have because of this, because of the construct of this bill. That's our concern.
The 8 to 9 million people that you refer to that might have to change their coverage, keep in mind out of the 300 million Americans that we're talking about, would be folks who the CBO, the Congressional Budget Office, estimates would find the deal in the exchange better, would be a better deal.
That's what we're now talking about. Those 8 or 9 million Americans who, now the question is whether or not the deal is better. The question is whether they can afford the deal with the subsidies that some of them are eligible for, and also whether they can get on the website to see the deal. But this is not a real secret. So when President Obama, came to the realization this week that, it wasn't true, he knew it wasn't true back then.
That point about keeping your health care plan, that's an important one. How many times did we hear this from the president?
If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period.
But that was never the whole story. It was simply not credible that the Obama administration and Congress would make a number of sweeping changes to health insurance and everyone would still get to keep their health care plan and their doctor.
Major Garrett.
Thank you, Mr. President. You said while the law was being debated, if you like your plan, you can keep it. You said after the law was implemented or signed, if you like your plan, you can keep it. Americans believed you, sir, when you said that to them over and over. Do you not believe, sir, the American people deserve a deeper, more transparent accountability from you as to why you said that over and over when your own statistic published in the Federal Register alerted your policy staff, and I presume you, the fact that millions of Americans would, in fact, probably fall into the very gap you're trying to administratively fix now? That's one question. Second question. You were informed, or several people in this building were informed, 2 weeks before the launch of the website that it was failing the most basic tests internally. And yet a decision was made to launch the website on October 1st. Did you, sir, make that test? And if so, did you regret that?
Okay, on the website, I was not informed directly that the website would not be working as the way it was supposed to. Had I been informed, I wouldn't be going out saying, boy, this is going to be great. I'm accused of a lot of things, but I don't think I'm stupid enough to go around saying this is going to be like shopping on Amazon or Travelocity a week before the website opens if I thought that it wasn't going to work. So clearly, we and I did not have enough awareness about the problems in the website. Even a week into it, the thinking was that these were some glitches that would be fixed with patches, as opposed to some broader systemic problems that took much longer to fix, and we're still working on them. So that doesn't excuse the fact that they just don't work, but I think it's fair to say that no, Garrett, Major, we would not have rolled out something knowing very well that it wasn't going to work the way it was supposed to, given all the scrutiny that we knew was going to be on the website. With respect to the pledge I made that if you like your plan, you can keep it. I think, and I've said in interviews that there is no doubt that the way I put that forward unequivocally ended up not being accurate. It was not because of my intention not to deliver on that commitment and that promise. We put a grandfather clause into the law, but it was insufficient. Keep in mind that the individual market accounts for 5% of the population. So when I said you can keep your health care, I'm looking at folks who've got employer-based health care, I'm looking at folks who've got Medicare and Medicaid, and that accounts for the vast majority of Americans. And then for people who don't have any health insurance at all, obviously that didn't apply. My commitment to them was you're going to be able to get affordable health care for the first time. you have an individual market that accounts for about 5% of the population, and our working assumption was, my working assumption was, that the majority of those folks would find better policies at lower costs or the same costs in the marketplaces, and that the universe of folks who potentially would not find a better deal in the marketplaces, the grandfather clause would work sufficiently for them. And it didn't. And again, that's on us, which is why that's on me. And that's why I'm trying to fix it. And as I said earlier, I guess last week, and I will repeat, that's something I deeply regret because it's scary getting a cancellation notice. But if you just got a cancellation notice, and so far you're thinking my prices are pretty good, you haven't been sick, and it fits your budget, and now you get this notice, you're going to be worried about it. And if the insurer's saying the reason you're getting this notice is because of the Affordable Care Act, then you're going to be understandably aggravated about it.
That the simple declaration was something the American people could handle, but this nuanced answer you just gave now was something they couldn't handle, and you didn't trust the American people with a fuller truth?
No, I think, as I said earlier, Major, my expectation was that for 98% of the American people, either it genuinely wouldn't change at all, or they'd be pleasantly surprised with the options in the marketplace, and that the grandfather clause would cover the rest. That proved not to be the case. And that's on me. And the American people, those who got cancellation notices, do deserve and have received an apology from me. But they don't want just words. What they want is whether we can make sure that they are in a better place and that we meet that commitment. And by the way, I think it's very important for me to note that you know, there are a whole bunch of folks up in Congress and others who made this statement, and they were entirely sincere about it. And the fact that you've got this this percentage of people who've had this you know, impact, I want them to know that you know, their senator or congressman, they were making representations based on what I told them and what this White House and our you know, administrative staff told them. And so it's not on them, it's on us. But it is something that we intend to fix.
Well, I can't breathe, I can't swallow, head to leg, come back tomorrow. Lying back with a heart attack in the front seat, yeah, beat, 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 red hot friends, drag me in, mercy back, Saturday night, take me down, hospital.